Hey there, and welcome to the deep dive. Ever feel like there's just way too much information out there and you need a shortcut to actually get it? Well, you're definitely in the right place. Today, we're jumping into something really fascinating. How traditional Chinese medicinal herbs can, work with Western medicine to treat infertility. Our insights today, they come straight from some really comprehensive materials provided by the Berkeley Center for Reproductive Wellness in New York City. And our mission for this deep dive is pretty clear. We want to unpack how these two powerful medical traditions, one ancient, one very modern, can actually team up effectively. We'll look at their history, how they're used, the evidence, and, yeah, importantly, their limitations, too.
It really is a remarkable synergy, isn't it? You've got this ancient wisdom meeting, well, cutting-edge science. And for anyone navigating fertility issues, or honestly, even if you're just curious about different healthcare options, understanding this kind of integrated approach is, I think, super relevant today.
Okay, so let's start laying the groundwork. For this integrated approach, we kind of need a quick primer on traditional Chinese medicine, or TCM. So at its core, TCM views your body as this dynamic, interconnected system. Health depends on the smooth, balanced flow of think of it like your vital life energy.
Right, flowing through pathways called meridians.
Exactly. And then you've got yin, which is sort of the cooling, nourishing aspect, and yang, the warming, active side. Plus blood, which TCM sees as a vital substance that nourishes everything.
That's a good way to put it. And when these things are out of whack, maybe you have key stagnation, which is basically blocked energy, or perhaps damp, like an excess moisture, making things sluggish. Well, these kinds of imbalances can really contribute to infertility. It's all about optimizing the entire system holistically.
Now, contrast that with Western medicine. It often brings these incredibly precise diagnostics, ultrasounds, blood tests, and very targeted interventions, like IVF. But here's where it gets interesting, right?
Yep.
TCM's holistic view isn't just an alternative. It can be a powerful complement.
Right.
It can help by addressing those underlying imbalances we mentioned, maybe even reducing side effects from some Western treatments, and kind of filling in the gaps where conventional methods might fall short.
Yeah, seeing them as partners is key. But, and this is really crucial, we need to be super clear about a major limitation right up front. Chinese herbs simply cannot fix structural problems. Things like, say, blocked fallopian tubes or significant anatomical issues in the uterus.
Yeah.
Or genetic conditions like aneuploidy, where embryos have the wrong number of chromosomes. Those things absolutely require Western approaches surgery or specialized genetic testing like PGTA herb support function. They don't, rewrite your physical structure or genetic code.
That makes total sense. A really important distinction. So, okay, where did all this ancient herbal wisdom even come from? Let's do a quick historical tour. Its roots go way, way back. We're talking the Shang Dynasty, maybe 1600 BCE. There are records of plant properties carved onto oracle bones.
Can you imagine? Cataloging herbs thousands of years ago. It's amazing. Then, jump forward to the Han Dynasty, around 200 BCE to 200 CE. That's when we see the first big herbal catalog, the Shenong Benkao Jing. It listed over 365 herbs, and many were already used for fertility, classified by how they affected qi, yin, yang, blood, basically how they helped restore balance.
Incredible foresight, and this knowledge just kept deepening, right? Through dynasties like the Tang and the Song.
Exactly. During those periods, TCM really refined its concept of syndrome differentiation, which basically means tailoring herbal formulas to your specific pattern of imbalance.
So not one size fits all.
Not at all. For instance, if someone had what TCM calls kidney deficiency, which relates to low reproductive essence, or Jing, think of it as your deep foundational reproductive energy. An herbalist would pick specific herbs for that. Or if the issue was blood stagnation, meaning poor circulation, they'd use a totally different set of herbs.
Got it. That personalized approach sounds key.
It really is. And by the Ming Dynasty, we start seeing texts focused specifically on women's reproductive health, like Fu Qingzu Nuke. They detailed very specific herbal strategies. So this rich history, it isn't just, quaint old tradition. It directly informs the sophisticated, integrated treatments we're talking about today.
Absolutely. Okay, so with that historical context, we can really see how these ancient remedies fit into the modern picture. Let's dive into female infertility first. We know female factors are a big part of the picture, maybe 40 to 50% of cases, affecting something like 15% of couples.
Mm-hmm. And in TCM, we look beyond just the symptom. We're looking at those deeper imbalances, so key blood, yin-yang, and how specific organ systems are functioning. Like the kidneys, which TCM considers the root of reproduction, the liver, managing energy and blood flow, and the spleen, overseeing digestion and dealing with that dampness issue. Optimizing these creates a healthier internal environment for conception to happen.
That whole system approach sounds really different. Let's take something common, like PCOS, polycystic ovary syndrome. Western medicine often uses drugs like clomiphene or metformin. They can work, but sometimes come with pretty rough side effects, right? Like ovarian hyperstimulation or digestive upset.
Yeah, they definitely can. And this is an area where TCM can offer some really unique support. There are traditional formulas, often with herbs that nourish the kidneys and liver. These can help regulate hormones, improve egg quality. There was actually a significant trial back in 2013.
Oh, yeah.
It showed that when a specific herbal formula, ETG, was used with IVF for PCOS patients, it actually increased both the number of good eggs retrieved and the pregnancy rates, which suggests these herbs might be doing something fundamental, like stabilizing the ovarian environment in a way Western drugs alone sometimes struggle to.
Wow, that's pretty compelling evidence. Are there other formulas used for PCOS too?
Oh, definitely. There are other blends. Some focus more on strengthening the spleen to clear that excess dampness we talked about, and soothing the liver to help energy flow smoothly. Studies on formulas like Bush and Watan have shown they can improve insulin sensitivity, boost ovulation rates, often complementing drugs like metformin, but potentially without causing as much digestive discomfort. It offers a gentler way to improve metabolic health and fertility for some people.
That's really interesting. Okay, what about endometriosis? That can be really challenging.
Yeah.
Western options like surgery or hormonal suppression, they work, but can sometimes impact future fertility or have side effects like bone density loss.
Right. Endometriosis involves that painful tissue growth outside the uterus. In TCM, it's often seen as involving blood stagnation and ply stagnation. So traditional formulas often use herbs that move blood and regulate ply. We have research showing these herbs can reduce key inflammatory markers.
Like cytokines.
Exactly. Things like IL-6 and TNF-alpha, reducing inflammation can help shrink the lesions and, importantly, improve the uterus's receptivity for an embryo. And here's a really striking finding, a big meta-analysis in 2011 looking at 8 trials. It found that Chinese herbs actually doubled the pregnancy rates for women with endometriosis compared to Western drug therapy alone over just 4 months. We're talking 60% versus 32%.
Wow.
Yeah. It suggests these herbs aren't just a minor add-on. They can potentially make a huge difference by addressing that underlying inflammation in a way Western medicine might struggle with without more invasive steps.
That's a massive difference. Okay, let's shift to another tough one. Poor egg quality or diminished ovarian reserve, DOR, Western RD, like IVF, often really struggles here because there just aren't many viable eggs to work with.
It is a very difficult area, no question. But TCM does offer specific formulas designed to enhance egg quality. They might work by improving the energy production within the egg cells themselves, the mitochondria, and reducing oxidative stress. One study, I think it was 2015, showed that certain kidney-nourishing and blood-moving herbs, when combined with acupuncture, actually improved IVF pregnancy rates in patients with DOR.
Really?
And even more compelling, perhaps, there was a case study published in 2017. It documented a successful live birth for a 43-year-old woman diagnosed with DOR. She achieved this after 6 months using only Chinese herbs.
Just herbs, that's incredible.
It really highlights their potential to, boost ovarian function even in challenging cases.
Okay, one more for female factors. Luteal phase deficiency, LPD. That's when progesterone might be too low after ovulation for implantation, right? Western treatment is often progesterone supplementation, but does that fix everything?
Well, progesterone helps, but it doesn't necessarily address the underlying reasons why the luteal phase is weak. It might not improve follicle development earlier in the cycle or make the uterine lining itself more receptive. So TCM uses formulas, often with herbs known to strengthen kidney function, remember. Kidneys govern reproduction and nourish blood. These are designed to provide uterine stability and improve the endometrial lining thickness. A large meta-analysis just came out in 2022.
What did it find?
It found that Chinese herbal medicine significantly increased progesterone levels and pregnancy rates in women with LPD, often with fewer side effects than Western therapies alone. It's about building a more robust foundation for the pregnancy to take hold.
That's a really thorough look at the female side. Now let's pivot. Male infertility, it's a huge factor too, right? Contributing to maybe 40, even 60% of cases. Often involves things like low sperm count, Poor motility, that's movement or morphology, the shape, or even DNA damage in the sperm.
Absolutely. And just like with women, TCM looks for underlying patterns, maybe kidney essence deficiency, energy blockages, or something called damp heat. For low sperm count and poor motility specifically, Western approaches often involve antioxidants like vitamin E, but the results can be pretty variable.
Okay, so if Western options sometimes have limited success there, what does TCM offer for male factors?
Well, there's a very famous classical formula, Wuzi Yanzong pill, often called WZYZ. It includes herbs like goji berry, dodder seed, schizandra berry. These are traditionally used to nourish kidney yang, that active warming energy and kidney essence. This is thought to boost the quality of the seminal fluid, things like seminal fructose levels, which feed the sperm. And there's good modern evidence, too. A 2018 meta-analysis looked at several randomized controlled trials, and it found WZYZ significantly increased both sperm concentration and motility. It shows how these traditional ideas can translate into measurable improvements in key sperm parameters.
That's a direct impact. Are there other options too?
Oh, yes. Another approach uses formulas like Shenjing capsule, which often includes herbs like astragalus and epimedium or horny goatweed. These are thought to help boost testosterone naturally and enhance sperm motility. A 2020 study actually showed higher pregnancy rates in couples where the man took this kind of formula compared to just vitamins alone.
Okay, and what about those other tricky issues? Poor sperm shape, morphology, or DNA fragmentation, DFI. You said antioxidants don't always fix those.
Right, those can be tougher nuts to crack. For these, TCM might use formulas like Yangjing capsule, again, often with kidney-nourishing herbs like astragalus or Chinese yam. The idea is they can help lower DFI by reducing oxidative stress, those damaging free radicals, and stabilizing the sperm DNA. Actually, that same 2018 meta-analysis on WZYZ also showed it helped reduce DNA fragmentation. And other research, some from Japan, I believe, noted that certain individual herbs, like shanzu yu, could dramatically improve sperm morphology, like by over 50% possibly, by enhancing key enzyme activity needed for fertilization. So it's really about improving the fundamental quality and integrity of the sperm, which is obviously crucial.
That's quite profound. Okay, let's touch on preventing miscarriage. Such a heartbreaking issue for so many, often linked to things like that luteal phase defect we discussed, or maybe fibroids, hormonal imbalances. Western options like progesterone or sometimes blood thinners like heparin can help, but again, potential side effects.
Exactly. And this is another really key area where TCM can offer significant support. Those formulas we mentioned earlier, the ones that nourish blood and enhance the uterine lining's receptivity, like Gushin anti-pills, they're very commonly used here. They can really complement Western progesterone therapy by helping to stabilize the pregnancy environment, potentially without adding more hormonal side effects. There is a 2020 randomized trial that found one such formula increased the ongoing pregnancy rate by about 15% in women undergoing frozen embryo transfers with hormone therapy.
15%.
Yeah.
That's really significant when you're talking about carrying a pregnancy to term.
It absolutely is. And looking more broadly, a 2023 meta-analysis confirmed that Chinese herbal medicine overall seems to reduce miscarriage rates in cases of threatened miscarriage. It likely works by helping to improve hormonal balance and uterine stability. We even have that 2017 case study, again, the 43-year-old woman with DR and fibroids. She conceived using a formula with herbs like danshen and shudi huang, which helped balance her estradiol and progesterone levels, working alongside her Western care. It's really about optimizing the body's ability to maintain the pregnancy.
Okay, so after hearing all this really compelling evidence for synergy, let's circle back to those limitations we flagged at the start. It's important to be clear, what can't TCM fix?
Right, absolutely crucial to reiterate this. Chinese herbs cannot treat significant anatomical blockages or malformations. Think blocked fallopian tubes, severe uterine shape abnormalities, or obstructions in the male reproductive tract. Those require Western surgical or procedural intervention, period. Likewise, an aneuploidy, abnormal chromosome numbers in the embryo, which is a major factor, especially with age, that's outside the scope of herbs. That needs genetic testing of embryos. PGTA herbs support the health and function of the uterus, the ovaries, the sperm, but they don't correct fundamental structural defects or genetic errors.
That's a really clear and important boundary.
Mm-hmm.
So then how do these herbs actually work, like on a biological level? What are the mechanisms behind this synergy we're seeing?
It seems to be multi-leveled. They're not usually like a drug with one single target. Many Chinese herbs seem to help regulate the body's main hormonal control centers. That's the hypothalamic pituitary ovarian axis, the HPO axis in women, and the HPT axis involving the tests in men.
Wow, the master controls.
Pretty much. They also often have significant anti-inflammatory effects, reducing that systemic inflammation that can quietly undermine fertility. And many improve blood flow, particularly microcirculation, to the reproductive organs. Well, for example, some herbs like ginseng might have components that gently mimic beneficial steroid hormones. Others, like huang qi or astragalus, can actually upregulate factors like VEGF, which promotes healthy blood vessel growth, crucial for the uterine lining. So it's this systemic, holistic effect. It strengthens the body's overall internal environment, which likely makes the targeted Western interventions, like IVF, more likely to succeed.
Yeah, that makes sense. It's like the integrative approach elevates things because TCM's broader focus complements ART by improving that overall systemic health. It's building a stronger foundation, really.
Wow, what an incredible deep dive. This integrated approach combining Chinese herbs with Western medicine for fertility, it really does seem powerful. We've seen how it can potentially fill crucial gaps, addressing those holistic imbalances, maybe reducing side effects, and boosting outcomes for conditions like PCOS, endometriosis, egg and sperm quality issues, and even helping prevent miscarriage. And yeah, while being really clear about what they can't fix those structural and genetic issues, the synergy with modern treatment seems undeniable. And it's backed by, a growing body of scientific evidence. It really offers a more comprehensive and hopefully more successful path for many people.
It makes you think, doesn't it? In a world facing complex health challenges, maybe embracing knowledge from different medical traditions isn't just interesting, it's essential. It can open up new pathways, offer new hope for these really deeply personal journeys. Perhaps the biggest takeaway today is this. When it comes to fertility, maybe like in life, the best solutions aren't always about choosing just one path, but about wisely blending the best of many. If you're curious and want to explore this topic more, you can find out much more by visiting www.berkeleycenter.com. That's www.dd.eer, berkeleycenter.com. Thanks so much for joining us on this deep dive into integrative fertility care.